All right. Good afternoon, everybody. Good afternoon. Welcome to today's last webinar for OTM, everybody. And hope all is well with you. I'm going to go ahead and share the presentation, everybody. Hope all is well. So for the last two Fridays, the first and foremost, we talked about just domestic violence awareness month. And the second week, which was last week, we talked about bullying prevention month, everybody. Now today we're talking about breast cancer awareness. All the awarenesses. Thank you for those who are tuning in briefly. You can always come back and watch the replay, everybody. But this is a very important topic that I'm sharing today because so many people are going through these things right now at this very moment in terms of dealing with breast cancer in terms of women and men. So I'm going to go ahead and open up in prayer and get ready for today's webinar. Lord, we thank you today as we come before you today, Father, and thank you for the understanding of you, God. I pray for every man and woman that's tuning into the live and the replay that they will learn something from this webinar today, God. Set them my heart, spirit, and soul today and bless anything that comes before them, Father. We thank you and honor you and bless your holy name. In Jesus' name we pray. Amen. All right, everybody, let's go ahead and get started. So as you can see, Breast Cancer Awareness Month, Pastor Johnson, October 27, 2023 at 1 p.m. So what is breast cancer? So I'm going to go ahead and mute my microphone. I have a chance to look at a lot of these videos that I'm sharing with you all today.
Cancer is an umbrella term to describe a plethora of diseases. All the cells in our body are very tightly regulated and respond to very specific signals. Mature cells have three options governed by these: to divide, to stay as they are, or to experience programmed cell death. Most mature cells do not undergo rapid cell division and continue to stay as they are. Programmed cell death is actually a good thing, and it is a way for our body to get rid of cells that are getting old and not functioning properly. In cancer, however, cells do not respond to normal signals and undergo rapid and regulated cell division and acquire mechanisms that allow them to evade programmed cell death. In short, a cell is said to be cancerous when it keeps on dividing and ignores signals to stop. The origin of such a cell dictates the type of cancer. For example, a cell originating in the breast causes what is known as breast cancer. Breast cancer and it is the fifth leading cause of cancer. Breast cancer, like all other cancers, encompasses various subtypes. Each of these subtypes is different in terms of prognosis, treatment options, and aggressiveness. So a treatment that works for one breast cancer subtype may not work for another subtype. Contrary to popular belief, breast cancer can affect both men and women. Early detection greatly increases the chance of successful treatment. Thus, it is best to remain vigilant and concentrate your breasts and familiarize yourself with their normal appearance. This will make it easier for you to spot changes that may be indicative of breast cancer. Some of these changes might include itchiness, abnormal discharge from the nipples, discoloration of the skin, and etc. Breast exams by myself and a healthcare professional are also recommended. It is also recommended for women aged 50 and over to get a mammogram every 2 years. The risk of developing breast cancer also increases if you have a history of breast cancer in your family, earlier menstruation, late menopause, have denser breast tissue, are exposed to carcinogens, use hormone-based contraceptives, or increased alcohol consumption.
For Andre Martes, it was just another day at the gym.
I had a big vacation planned, beach vacation.
But days after lifting weights, he was still feeling the burn, even when the normal muscle ache should have been gone.
I noticed though something was different on my left side. I had the soreness.
First, Andre thought something was wrong with his heart.
After a few tests, you go home, go eat a burger. You are in very good health. I went to have a physical. Again, the doctor cleared me like, you great health, go live your life.
Then late one night, something woke Andre from his sleep.
I started poking myself deep to try to find something, and I found a lump deep within the skin. in the Mite's area.
So you went to a friend of yours who's a nurse.
She sent me to a mammogram, and then the mammogram showed something that needed to be further looked at. And a few days later, I had a biopsy, and they confirmed that I had breast cancer.
This was the small tumor found in Andre's breast.
Dr. Ruth Oretz is a medical oncologist at NYU Langone Perlmutter Center. She helped treat Andre and guide him through his cancer battle.
Andre's breast cancer is really how we see men present. They feel something abnormal in the breast. Maybe there's a little swelling or a lump. In Andre's case, he really acted on it. He didn't ignore that symptom.
About 1 in 833 men develops breast cancer in his lifetime, according to the Breast Cancer Research Foundation. Compared to women, that is rare. 1 in 8 women is diagnosed in her line. A recent study from Vanderbilt University shows that male breast cancer patients have a 19% higher mortality rate than female patients, and that might be because most men catch it late.
Pay attention to your own body. Don't be ashamed or shy to go and ask for someone to check something out if you think it looks weird on your breast or even under the arm if there's a swelling.
Andre caught it early, stayed away. He went through surgery, radiation, chemotherapy, and is now going through hormone therapy. But for the first since his diagnosis, Andre can say he's cancer-free. What do you want other men? Like you said, this is not something that I don't think any of us really think about.
Think about yourself, your own car. When a warning light comes on or your tire is deflated in your car, usually you are not going to ignore it. So if you feel something, get checked. It could save your life. It definitely saved my life.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.
A breast lump is the most common presenting symptom of breast cancer. But for about 1 in 6 women with breast cancer, the broad spectrum of symptoms doesn't include a lump. In this video, I'll tell you about the early signs of breast cancer and what to do next. Cancer occurs when breast cells mutate and grow out of control. If breast cancer spreads, it typically goes to nearby nodes under the arm first, or around the collarbone. If it spread beyond these small glands to other parts of your body, it's called metastatic breast cancer. Metastatic cancer is incurable, so early diagnosis is very important. Most breast changes are due to hormonal changes and are nothing to worry about. However, if you experience the following 5 breast cancer symptoms, see your doctor, even if they seem mild. 1. A lump in the breast or armpit. 2. Discharge from the nipple. 3. Dimpling the breast. 4. Nipple changes, including the nipple turning inward, pulling to one side, or changing direction. 5. Irritation of the skin. Your risk for breast cancer increases with age. About 77% of women are over the age of 50 when they are diagnosed with breast cancer. Less than 1% are diagnosed in their 20s. If you have a close relative, a mother, sister, or daughter, who has had breast cancer, your own risk of developing the disease doubles. If 2 of these relatives have disease, your risk increases 5 times. In many cases where breast cancer seems to run in families, a mutation in specific genes called BRCA1 and BRCA2 contribute to the cancer. If you started menstruating before age 12 or went through menopause after age 50, your risk for breast cancer also slightly increased. That's because your breast tissue is exposed to estrogen for longer periods of time. And finally, there is a clear link between alcohol and breast cancer. Those 2 to 5 alcoholic drinks daily have 1.5 times the risk of developing breast cancer as women who do not drink. If you think you might have breast cancer, what should you do? The most important screening test to detect breast cancer early is the mammogram. A mammogram is an X-ray of breast. It can detect breast cancer long before a tumor might develop. It is recommended that women aged 40 and older receive annual mammograms. Studies show that women who participate in mammography screening reduce their risk of dying from breast cancer by 41% and experience a 25% reduction in the rate of metastatic breast cancers. Schedule an appointment with your doctor today to discuss your screening options. Thank you for watching this video. Please watch my next video if you want to know how people die from cancer or how to recognize the symptoms of a dying person.
So I was 34 years old at the time. I was my friends, just living my best, honestly. I thought I was on top of the world. And that's when I found this bump on my chest. When I went to the doctor, he looked at it and he said, well, I think you're okay, but like this might sound a little weird. We're gonna do a mammogram just to make sure it's nothing. And I didn't even think it was anything, so I was like, whatever. But then eventually he called me and told me that I had stage 2 breast cancer. Everything just completely stopped. I was like, okay, did they really say what they just said? So my grandmother had breast cancer and she passed away from it. And I pretty much thought it was women only. I did not know that men could get breast cancer. So, I was terrified. But when I got diagnosed, I did do the genetic test. And I found out that I had the BRCA2 mutation. I told my brother, I said, you need to get checked out because this runs in our family. And families need to know that. So my treatment was surgery, chemo, and radiation. I lost about 30 pounds. I couldn't eat. I would be shaking. It was that bad. During my treatment, I kept it a secret. I didn't tell anyone. As a man, there was definitely a stigma, and I just didn't want those questions. So I was fighting for my life, and no one knew what was going on. And then I remember one time I asked my friend, I said, can I stay with you? I thought if I had gone to sleep, I was not gonna wake up. The following day, I was like, okay, you can do this. It's okay to ask for help. And so after that, my family, my friends, they were so supportive. They would bring me food. They would just be there for me. I have been cancer-free for 2.5 years. I'm in a good place, and I will continue to go to the doctor. I will continue to make sure I'm okay. But it's a lot different now because I realized there's something powerful about being vulnerable. It is powerful to ask for help. It is powerful to have people included in your life that love and want to support you. That's strength.
I was 55 when I was diagnosed with triple negative breast cancer. When I told my mom, she immediately cried, and she actually blamed herself. And she said, the worst fear I've ever had is passing breast down to you. My mom was 50. She was diagnosed with stage 0 breast cancer. But she didn't really stop cancer in our family until I got sick. And I said, Mommy, do we have anybody that we know with breast cancer? And then that's when it hit her that her aunt had died of breast cancer. And then I said, how did your grandmother die? And she said, a female cancer. And I said, well, what does that mean, Mommy? And she said, well, my mother didn't really talk about it. But that's typical of Black families. We just don't talk about health. And that's because a lot of Black moms or single moms are the breadwinners for their families. And so they don't want to talk about disease and tell people they're sick because they'll make them afraid that they can't take care of them. And we're over that. We have to know about who had a disease before us in another generation. It could help save lives and people from dying. So a year to the date that I was diagnosed, the cancer came back. My doctor said, get your affairs in order, 2 years to live. 10 years ago. So I'm very blessed. Black women under the age of 35 get breast cancer at twice the rate than white women, same age. So my life's mission is to eradicate Black breast cancer. And it's really based on my 3.5-year-old granddaughter. Well, get it, she's going to get boobs in about 10 years, and I don't want her to ever think about breast cancer. So I got 10 years to do this work.
When you see a pink ribbon, especially during the month of October, there's a good chance you automatically think breast cancer awareness.
And it's safe to assume, but have you ever stopped to why? Why the ribbon? Who chose the color pink?
Well, it's a story history lesson, ladies. Cleveland.com's Brianna Bowles is here now with the real story behind the pink ribbon.
Candace, the story of the pink ribbon is a very interesting one. And actually, half the story started back in 1979, believe it or not, with a yellow ribbon. It was then that the wife of a hostage who had been taken in Iran was inspired to tie yellow ribbons, like this one, around the trees in her front yard. Now, according to the website for Susan G. Komen for the Cure, she did it as a way to show her desire to see her husband come home again. So about 11 years later, AIDS activists saw that yellow ribbon that had been resurrected for soldiers fighting the Gulf War and turned the ribbon bright red. Then they looped it, they spruced it up like you see here, and sent it onto the national stage during the Tony Awards to represent those affected by AIDS. And with that, the team at Susan G. Komen says the stage was set for the breast cancer awareness ribbon. Now, Susan G. Komen, an organization started in 1982, has used the color pink that we all know and love since day one. In fact, the first ever Komen race for the Cure logo design was an abstract female runner outlined with a pink ribbon. According to the group's website, that logo was used from the mid-'80s to the early '90s. In 1990, the first breast survivor program was launched at the Komen National Race for the Cure in Washington, D.C., where survivors wore buttons printed in black and white. The survivor program developed later that year, and pink was used as the designated color for Komen to promote awareness and its programs. In '91, pink ribbons were handed out to all breast cancer survivors and participants of the Komen New York City Race for the Cure. And in '92, Alexandra Penny, the editor-in-chief of Self, wanted to do something to the magazine's second annual Breast Cancer Awareness Month issue over the top. So, of course, she did it by creating a ribbon and asking cosmetic giants to distribute them in their New York City stores. And that, ladies and gentlemen, was the birth of the pink ribbon. Now, to share that little history lesson with someone you know, and for more breast cancer awareness-related stories, go to clickorlando.com. Ladies,
That's interesting.
Yes, it is.
It is pink in the studio for a reason. October's breast awareness Cancer Month, and we're going to be talking prevention, how you can also treat the disease, and also how we can help.
Yes, a very important month devoted to education, the importance of early detection, and access to quality care. So to get us all on the same level, I wanted to start with basic numbers. So first off, breast cancer. It represents approximately 30% of all cancers, and also unfortunately, it's the most common cancer diagnosed within the United States. That equates to approximately 240,000 women and almost 2,000 men each and every year. The incident rate we've seen in recent years, unfortunately, has increased by about 0.5%. Secondly, risk factors. The most common risk factor is age. The median age of diagnosis is the age of 62. That means that half of those diagnosed are under the age of 62. So inherited genetic risk factors, family history, first-degree relatives with a history of breast or ovarian cancer, and those who have dense breasts. And to be specific about that, density, breast density is diagnosed on imaging. It's not something that can be diagnosed on exam.
You got to get your imaging done.
You got to get the imaging done. Bringing it to that screening, screening and discussions about screening should start at the age of 40. And most people don't realize it, but most insurance coverage, it should be all, cover mammograms every 1 to 2 years for women at the age of 40. It's important to understand your coverage the very same way that you understand your bank account. And then the most important number is survivors. Right now in the United States, there are more than 4 million women that are surviving breast cancer and currently undergoing treatment. And I think that number is the most important, especially to draw on that collective strength.
They are thriving, and early detection is key.
Absolutely. And many don't realize it, but if you find breast cancer at the earliest stages, your 5-year survival rate can be as high as 99%. So start that discussion about mammograms. Get in there and make sure that you just answer get all your questions answered.
And look, I can say it can scare you to go in and get that imaging done.
Sure.
But it's so much more important to do it now and get it early.
Yes, get it out of the way. Unfortunately, in the emergency room, I'm usually at the very beginning of many stories of their breast cancer when they're finding masses and trying to understand what can be the cause. And again, getting it out of the way is so important. Don't put it off. It's your health. Treat it as the most important thing.
Thank you.
Hey there, James. Robert. Thanks for checking out our YouTube channel. A lot of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. Thank you for watching, and we'll see you in the morning. May.
Putting it off for weeks, just like so. About that mammogram, I've been putting it off for weeks, just like you. We're busy people. I'm a mom too. I just don't have the time. Plus, I am a little nervous. I have no idea what to expect. But the truth is, it's just smart. Early detection does save lives. So here's what I did. I made myself an appointment at Johns Hopkins Medical Imaging. I went online to my chart. I picked the date, time, and location. So simple. So, I'm going, and you're coming with me.
At Johns Hopkins, we support that women at average risk for breast cancer should start mammograms at age 40. We think that's really important. We know that annual mammograms has the greatest chance to detect breast cancer early. And when we detect breast cancer early through screening, we know that that's when it's the most treatable.
Hey, welcome to Johns Hopkins. How can I help you today?
I have an appointment.
Okay. I just need you to sign in right here on the computer.
Okay.
We know that this type of exam can make women nervous. From the moment you walk in the door, we aim to make you comfortable.
I'm going to take you back here. Oh, okay.
Now.
All right.
Have you followed?
Okay.
Okay, so excuse
Thank you.
Everything you're going to need is right here in your dressing area. You have your gown. Everything's going to be heated up from the waist up off. We also have a robe for you putting on so you're not getting too cold or chilly.
Okay.
And did you have any deodorant or powders on to go today?
No, I was told not to wear it.
Perfect. Wonderful. Well, I'm going to have you go ahead and get changed. I'll be right back with you in a few minutes.
Okay.
Okay?
Sounds good. Thank you.
Welcome. Every single technologist is trained, specialized in this type of exam, and that is all we do. We're going to start with the right side. Okay, I'm just going to come around you here.
Okay.
I'm going to have you take your right arm. I just want you to grab right here for me. Bend your elbow, and I want you to lean in on this corner. Perfect. All right. I'm just going to come underneath. Just after doing mammography for many, many years, we are trained in little tiny tricks in how to move the patient's breasts around, how to move them in perfect position, how to compress them a little so that they are very, very, very comfortable. A little squish, but it's going to be very quick.
Having a really experienced technologist performing the mammogram is very important for us. The positioning, I can't emphasize enough, is crucial to us being able to interpret mammogram appropriately.
Are you doing okay?
Yes. Yeah.
Great. All right, I'm just going to ask you to hold still just like that for me. We're going to take a quick picture and just hold your breath.
When a woman gets a mammogram, 4 total pictures are taken, 2 pictures breast. Each of those pictures on a 2D mammogram is just 1 picture to look at. On a 3D image, you're able to scroll through that image and see multiple layers within that one image. So a 3D image really helps clarify for us as radiologists whether a finding might just be overlapping tissue or whether there could be a mass under there.
You may breathe.
Hey, not so bad.
Doing okay?
Yes, thank you.
Fabulous. We are all finished.
All of our breast imagers are breast imaging specialists, and that's important because it's well known that radiologists who exclusively read breast imaging and read a higher volume of breast imaging have a higher cancer detection rate, and that means that we're picking up more cancers.
What was I worried about? I have no idea. It was so fast, so easy. It was just a little squish for about 4 seconds. The tech told me everything that was going to happen, which was awesome.
If there's additional findings on your mammogram, we will actually call you to let you know so we can bring you back in for any additional imaging that you might need.
After a patient has their mammogram, the radiologist usually the next day. In 90% of cases, the images look great and normal and the patient is notified by mail. In about 10% of cases, we need to clarify an additional finding, so the patient needs to come back to return for additional imaging.
Once the radiologist has read the report, the results will go into within 24 hours.
Okay.
A screening mammogram takes less than 5 minutes. It's not that uncomfortable, and it saves us.
You know what? I could totally do that once a year. It feels good to know what's going on with my health.
Not often talked about is men's breast cancer. Researchers say men rarely get breast cancer, but those who do often don't survive as long as women, largely because they don't even realize they can get it and are slow to recognize the warning signs. The American Cancer Society estimates 1 in 1,000 men will get breast cancer versus 1 in 8 women. By comparison, 1 in 6 men will get prostate cancer, the most common cancer in men. On average, women with breast cancer live 2 years longer than men in the biggest study yet of these in males. Dr. Fred Wittenstein, radiologist at Florida Hospital Waterman's Digital Mammography Center, says men are becoming increasingly aware of their risk.
We actually do quite a few mammograms on men. And it's a little different for men because the Women's Center here at Florida Hospital Waterman is obviously set up for only women. Generally, I'm the only man in the department. So when a man comes in for a mammogram, he's got to wait in a whole different waiting area than the women do, just to keep everybody more comfortable. But men can get breast cancer. Men can get swelling or abnormalities in their breast. And again, the majority of those are benign. But it's very unnerving and worrisome, and it needs to be worked up. Most of these are what's called gynecomastia, which just means swelling of the breast. But men come in, they get a mammogram just like a woman. They get compressed in the mammogram machine just like a woman. And after their mammogram, we'll review the films and talk to them and let them know what we think. Male breast cancer is usually detected later than female breast cancer, and the main reason is just because men don't pay attention to it. They're not thinking about breast cancer. If they find something in their breast, they think it's because they injured themselves, they were working out too hard, or they banged into something, and they tend to put it off and ignore it. The incidence of male breast cancer is small but real, and what happens is when a man does notice something in his breast, his physician will send him in to have a mammogram, and we do it exactly the same way as a woman. As you may have realized, men don't have baseline mammograms, but the good thing is usually male problems are only on one side, so we use the other side comparison. The problem with male breast cancer is it's so rare that the statistics that we have for women aren't as well defined for. And so a man who has breast cancer, no one's really sure if there's an increased risk for his daughter or his granddaughter to have increased chance of breast cancer, and for the son of a man with breast cancer. They're generally considered independent risk factors, and we don't think that it's more likely they'll have cancer.
There are no formal guidelines for detecting breast cancer in men. The American Cancer Society says routine, across-the-board screening of men is unlikely to be beneficial because the disease is so rare. For men at high risk because of a strong family history or genetic mutations, mammograms and breast exams may be helpful, but men should discuss this with their doctors. That's according to the American Cancer Society. For more information on Florida Hospital's digital mammography services for men or women, follow the Male Mammogram Story link on our homepage at yourhometownhealth.com.
Breast cancer can affect men. The incidence is relatively low. It represents less than 1% of all cancers in men and less than 1% of breast cancers. In the UK, we see roughly 390 new cases per year with a lifetime risk of 1 in 870. Compare that to 55,000 new cases of female breast cancers per year in the UK with a lifetime risk of 1 in 7. The incidence of male breast cancer is relatively low. And because we don't talk about it very much, so it's important to raise awareness around this topic. What does male breast cancer look like and how do you treat it? There are certain things that can increase the risk of men developing breast cancer. If you want to know what these are, check out a video I have made talking all about this, and I'll leave the link in the description below. So, what does breast cancer in a man look like? Well, it actually looks like how a breast cancer would in a woman. It normally presents as a lump, usually behind the nipple area, but it can also present anywhere in the breast. It can also present with nipple retraction, skin changes, as well as nipple discharge. Now, men can also get a condition called condition that also presents a lump area, and a clinical examination and scans should be able to tell the difference between these two conditions, gynecomastia or cancer. If the appearance is suspicious, then we'll do a biopsy to confirm the exact nature of the. Do you see the same types of breast cancer in men as you do in women? Yes, actually we do. Male breast cancer commonly originates from the ductal system, and so you will commonly see ductal carcinomas. Unlike in women though, the anatomy of the male breast is such that there are very few lobules, and so lobular cancers are not that common. Overall, male breast cancer is more likely to be estrogen receptor positive and HER2 negative, and they're less likely to be triple negative as well. Now, because we don't have a screening program for men, together with the lack of awareness, breast cancer in men usually presents as larger cancers compared to women, and there's also more often lymph node spread or metastases. 42% of males compared to 33% of women. So how do you treat it? Well, you treat it in a similar fashion to female breast cancers, and this may involve surgery, chemotherapy, radiotherapy, as well as endocrine treatment or tablets. So let's talk about surgery. Traditionally, mastectomy or removal of entire breast would be the surgery most commonly recommended. And this is because the male breast doesn't contain much breast tissue, and so a mastectomy is usually preferred to make sure that we completely remove the cancer in one go, and at the same time allowing a good cosmetic outcome. However, having a lumpectomy is possible, especially if the cancer is small and if there is enough breast tissue to allow the closure of the defect. Radiotherapy. Observational studies have shown that breast cancer conservation with radiotherapy has similar survival rates compared to those who had a mastectomy, and yet we don't do enough breast conservation surgery in men. The data suggests that roughly only 52% of with breast cancer having had conservation surgery will get radiotherapy. Now let's talk about chemotherapy. Like in women, men who are eligible should be offered chemotherapy, both in the neoadjuvant as well as the adjuvant setting. Although the data of the benefits of chemotherapy in men is from observational studies, it has been shown to improve survival rates. And lastly, let's talk about endocrine treatment. Since most male breast cancers are estrogen positive, endocrine treatment plays an important role in treatment. And tamoxifen is the most studied and is the recommended treatment. So, is there a survival difference between men and women with breast cancer? The American SEER, or Surveillance Epidemiology and End Results Registry, is a bit of a long word. That database suggests that men have poorer survival for stages 1 to 3 compared to women. However, the relative survival rates, which is obtained after adjusting for older age at diagnosis and poorer life expectancy, it actually shows survival rates are quite similar between men and women. It's really important to increase awareness to encourage men to do self-examination and to seek medical help early.
I was very apprehensive in the first, and somebody had told me what the reality of it was, I wouldn't have been as anxious. Everybody around me is trying to do the best thing for me, and that they're on my side. You will get through it, and you can get through it, and it's nothing that you can't overcome.
I find one of the best ways for a person to feel more confident and less just about their treatment is to really have some good information about what to expect. Many people don't have much experience with chemotherapy, and it's hard to imagine exactly what would happen on the day that they get their treatment.
Chemotherapies are drugs used to treat cancer, and they're often intravenously. Unlike surgery or radiation that target one area in the body, chemotherapy goes through the bloodstream and can kill cancer cells anywhere in the body.
For the first time, you can read what's going on, but it's very different when you get here. The nurses are here, the support is here. Try to rest before treatment in the morning as you would take your medications. Try to do your routines. The patient care assistant will take your vital signs, your blood pressure, your height and your weight, which we do every time that you're here for treatment.
We would start an IV, so it would be a regular IV in the arm. Sometimes people have a device that we use called a Mediport to administer the treatment. We would draw some blood to check and be sure the blood counts are okay and that other blood tests are all right to begin treatment.
Send it to the lab. The lab is right on site, and then we always look at your blood work first, then we order your medication.
So we would see the doctor or the nurse on the same day. And then we would begin a series of intravenous treatments to prevent side effects, followed by the therapy itself. The length of time all of that takes varies from person to person and depending on the type of treatment you're getting, but usually it would be anywhere from about 2 hours to the better part of a day.
We do have a television with different channels that they can occupy themselves with at the moment. We have magazines, or they can bring a book to read, they can bring a Kindle to read. There's also a lot of patients, they choose because the night before they're not sleeping a lot, the chairs are reclined and they get comfy. They can also close their eyes and we will still take care of them. That's not a problem to worry about. Also, a family member is always a good idea. If someone is able to come with you to have pastime. A lot of patients, it goes by faster when they have someone sitting there just talking, and the time just goes by a little quicker for them in that sense.
Some patients expect maybe bolt of lightning or something, or shockwave, something to go through them. They've heard so many things from other people, and so I reassure them that maybe it's going to be rather anticlimactic. You're not going to feel anything except cold fluids going into you. You might feel drowsy, so you'll get some Benadryl as pre-meds, but for the most part, you're not going to feel like someone is shocking you, hurting you, anything like that.
I thought that there would be a further pain that I never experienced. The pain that I did feel was the after effects.
The side effects of different chemotherapies vary and may not become apparent until several days after your treatment. Common side effects include nausea, vomiting, or fatigue. You may have these side effects or none at all. It's important to remember that we have a multidisciplinary team available for helping to manage all of the side effects of treatment.
A lot of times when patients are going through chemotherapy treatment, it's easy to get caught up in what you have to do this week, or what are the side effects that I might have. But it's important to think about what we're trying to accomplish with the treatment.
I had to learn how to relax. I was an extremely active person. One of the greatest difficulties I've had so far was learning how to rest, learning when to stop, and yeah, that was my biggest problem throughout the entire thing. I got myself in trouble a lot of times not knowing when to stop and when to rest.
Receiving a diagnosis of cancer and going through treatment can be very stressful. I think it helps people if they can stay positive as they go through their treatment, but it's also important to have a good understanding of their diagnosis and of the treatment, and to have reasonable expectations. The other thing that's important is to know when to act. It's normal to feel depressed and anxious as you're going through treatment, and there are things that we can do to help with these feelings as you're going through the treatment.
I would say someone who's going to treatment right now, to have a positive attitude, to believe and be willing to fight, not to lay down and say, oh, I have cancer, I'm going to die. Be willing to fight.
Just sit tight and go for the ride. It's going to be a rough and bumpy ride, but at the end of it, you will be in a better place. Just believe that you can be treated. Believe that treatment is possible and recovery is possible, and you can get better. Just don't give up. Just go in wholeheartedly and don't give up, and continue to fight.
During a mammogram, a technician takes an X-ray of a woman's breast. A radiologist then examines the image of tumors. Mammograms undoubtedly save lives. The number of deaths from cancer has fallen by 30% in the U.S. since mammography was introduced in the 1970s. That's because when cancer is found early, the chances of beating it are greater. Mammograms are the best screening tools available, but they aren't 100% accurate. A mammogram can look normal even when cancer is present, and it can look abnormal even though there's no cancer in the breast. Standard mammograms are two-dimensional, but for the 40 to 50% of women with dense breasts, both tumors and breast tissue can show up as white masses on 2D images. Three-dimensional mammograms show a more detailed view of the breast. Women with fibrous or dense breast may benefit from a 3D screening.
It might find disease that we need to find that two-dimensional not. There are potential cons in that it has a higher cost, higher amount of radiation given every dose, every time a person has the test, as well as it may find a higher number of false positives.
Cost aside, one study involving 13 U.S. hospitals showed that three-dimensional mammograms picked up an additional 40% of invasive cancers. For an even better picture, a woman could have an automated whole breast ultrasound.
This is a new screening technique. It helps detect additional breast cancers in females who have got dense breasts.
The whole breast ultrasound doesn't use radiation, and it takes up to 5,000 images of the breast.
This tool does not replace the traditional mammogram. Mammograms are the gold standard for finding breast cancer. This helps the mammogram in those females who have got dense breast.
Studies are underway to find out which techniques are the most effective. While North America, Western Europe, and Australia have the highest rates of breast cancer, the World Health Organization reports that almost 50% of the cases and nearly 60% of the deaths occur in developed countries. If we could improve detection and treatment, at least 400,000 women's lives could be saved every year. Carol Pearson, VOA News, Washington.
Women with elevated risk for breast cancer or those having a calculated lifetime risk of 20% or greater are recommended to have both an annual screening mammogram plus an annual screening breast MRI. Breast MRI is a breast cancer screening tool that is both used to detect breast cancer in its earliest possible stages and to evaluate the size and location of a known breast cancer. It can also be used to determine if a treatment, such as chemotherapy, has been effective to treat a breast cancer. MRI uses strong magnets instead of radiation to make very detailed sectional pictures of the body. An MRI scan takes pictures from many angles as if someone were looking at a slice of your body from the front, from the side, and from above your head. When preparing for the exam, you will be asked if you have any implanted devices that are not compatible for MRI, such as pacemakers or defibrillators. At the beginning of the exam, patients are changed into scrub tops and pants and are asked to remove all metal objects, such as eyeglasses and jewelry. An MRI technologist or nurse will place an IV in a patient's arm to deliver contrast during the study. This contrast agent helps to target cancer and to identify changes in the anatomy of the breast. Patients are placed onto the table on their stomach with their arms either resting at their side or slightly bent above their head. The scan should be expected to take approximately 5 to 60 minutes.
So I will call you and let you know.
You can expect your results within 24 to 48 hours, and these results will help to determine if any additional follow-up is needed.
Now let's talk about mammograms and what exactly to look for when you have a mammogram. I know we have two images here of a healthy breast mammogram and one that is concerned for cancer. If you can talk to us about this particular mammogram.
All right, so this is a single view of the patient's left breast, and this is a mammogram, and we're going to touch on it a little bit, that has the more dense breast tissue. And what we're seeing here in the upper part of the image, that sort of triangular appearance, is actually the pectoralis muscle. So that's the chest wall. So like Dr. Mottner was saying about going all the way up to the clavicle when you're doing a self-breast exam, we're imaging part of that breast tissue. And we're also imaging part of the axilla, the armpit. So this looks like a normal, healthy, dense breast.
But because it's a testing we were talking about before, would this patient be coming back more regularly for their mammogram only because of that density?
So no, not necessarily, but what they might consider doing is having a breast ultrasound to accompany the mammogram, not in place of, instead of, but in addition to. Sometimes breast cancers can be hidden, or what we call obscured, by the dense breast tissue. On this mammogram, the fatty elements are the black ones, and the more dense fibrocystic change is the white. A cancer in 90% of cases appears white, so it can get lost within that dense breast tissue on mammogram.
Okay, the next image we're going to see is actually a breast with cancer. So if you can talk to us a little about this, and yes, I see it's a big difference.
So just in terms of the patient's density, this is a more fatty breast. It has more of those black elements in it when you look at the image. The cancer in this case is a spiculated mass. It measures less than an inch. It's saying it's 1.9 centimeters. And so this is a patient who has not a dense breast, but it has a relatively fatty breast, but you can definitely make out the cancer in this case.
When you said spiculated, what does that mean?
So that means it has that star-like appearance. So you can see surrounding that white blob, the white mass, there are all these little gentle, almost like stellate spiculations that come out in sort of a radial spoke wheel appearance.
All right, everybody. All right. So we're going to get into what we just saw this afternoon. All right, everybody. So we did 51 minutes of today's webinar about breast cancer awareness. So it talked about men and women and the statistics and the different things they have to go through. It is a lot, everybody. And the information that I shared with you all this afternoon is going to help you understand it. As you can see, the difference between what men go through versus what women go through, it has it's a different facade of it, and it told you the comparison and contrast of these things. Um, Breast cancer awareness is very significant to me because my mother passed from it about 3 years ago, which is 2020, August 30th, 2020, metastatic breast cancer, which is a very aggressive breast cancer where it spreads to other parts of the body. And I, for myself, had to really think about, oh, I need to have an annual mammogram or an annual checkup for myself so that way I'm aware of what's going on with my body. Because as her daughter, it's very scary to see your mother that you've known most of your life go through these transformations just in a 4 year span. And it's overwhelming. But it also too makes you like, I need to take care of myself. I need to go get annual mammograms. I need to go get annual pap smears. I need to get all these things just as I do for myself. I'm encouraging others to do the same as a man and a female. Don't wait till it's too late. And I know most people may not have insurance, which is the big red flag these days. And some people who have insurance or don't have time to do these things. This is why a lot of cities have those community outreaches of free mammograms on the weekends because they know a lot of people work during the week. And show behold, it's good to get yourself checked out. It's good to go through the whole mammogram process and whatnot. I've experienced that in the last 3 years. I missed last year because they were tripping, but I was able to go this year and before then. So I get my mammogram every year because of the history of what went on with my mom. And I find that very, very important to do that because that really goes to show my health matters and I'm concerned about it and I want to make sure that I'm good. And to make sure that I'm good, I took it a little further and did, how would I say it? They do a blood draw to check your family history of any type of cancer, which I went through a few months ago, and to see if I'm at high risk. And let me just say, thank God that I'm not at high risk for any of the cancers that they were screening for, because that makes you like, man, if my family has a high risk of cancer, or what should I do? How should I handle it? This is why you have to be very proactive with your health, ladies and gentlemen. That goes for a male. If you know something's not right with your chest, fellas, and I'm being very serious right now, go get checked out. Most people don't like hospitals. Most people don't like doctors. Most people don't like being in any type of facility where they feel like they're gonna get bad news. But the reality is, the earlier detection is the better. That way they be able to treat it. My mom went through chemo, but she didn't go through the chemo where they did the IV drip. She took the pill from. And also, too, she did radiation treatment. She had a metastatic breast cancer, of course, but they did a mastectomy where they removed her breast, but she only had one left. I'm open and sharing about it now because, again, it's good. I am going to always honor my mother because she brought me in this world, and I'm going to honor her. And it's called love and respect. And the thing about it is, everybody, by her going through that, it really, really makes me proactive in my own life. And I go to doctor's visits every day. You know, say, hey, I need to go get myself checked out. Something don't feel right. I need to go to the doctor. I need to do it immediately. And I learned a lot during that whole time that she was going through the things that she was going through. That your health is really truly matters to you, and it's good to go get checked out. Even if you need to go and try to apply for Medicaid, even if you're trying to go and get Marketplace, even if you just got to go to the emergency room, you'll be surprised at the resources that you can get. And I don't know how other cities, states are, but a lot of them have clinics. A lot of them have agencies down here. I know Palm Beach County has Found Care. And those of you who go through some things, and I am part of the Riviera Beach Initiative, where they will take your pay stub and see what your income is and give you a rected scale of how much your copayment is if you don't have insurance. Two, if you do have insurance and your insurance covers everything, it's interesting how billing works with insurance, but I'm going to be very mindful. It covers everything, depends on what kind of benefits and plans that you are assessed with. So those of you who stay in Palm Beach County, Found Care is a good place and an outlet to go for any kind of resources in terms of everything. I went through Found Care for myself in terms of mammogram and any type of women care, and it's important. So support dealing with breast cancer is very important because people feel alone when they're in this space. They feel like that nobody's caring. There's other people out there in the world who has experienced this and has dealt with this, like really dealt with this. And it's like an eye opener to say, I'm alone. No, there's people out there, there's support group, there are people that can talk you through the steps and how to manage and how to deal with this and how you have your good days and bad days. As we watched the video, it talked about people who went through chemotherapy, the IV drip. And with the IV drip, they talked about the symptoms they had, nausea and throwing up, and also tiredness because of draining a life out of you. Radiation, with radiation, it leaves burn marks on you. We have to get a special cream to put on to make your body heal again. So that's the whole gist about radiation and chemotherapy. And the chemo pills are very, very high, strong pills where they tell you to take it for about 10 days and you have to stop to give your body a break because you don't want all that to be very aggressive. And that's some very expensive medication. Luckily, my mom's insurance covered it because it's like $10,000 pills. Like really very, very expensive. And those pills helped her and prolonged her life. And then they switched the medication from capsule to pill form, and then we started to see the changes in her. And that's when she ended up deteriorating and went down the hill. And then that's when things just kind of took a turn for the worse. And that's the story about that and how that kind of changed my whole perspective of my health. So I'm a big advocate for breast cancer. I'm a big advocate for all the stuff that I shared here these last 3 weeks on a Friday. I take what I do very seriously on this platform, everybody. I just pray that you all take everything that was shared here and share with other people about the resources that I share with you all and the information because I love for people to be informed and aware about these things that's going on because it's very, very important. And you asked me, for those who may want to ask, how did you deal with all that? It was very stressful. And being that I'm home with the daughter, I have a brother, he's about 49. But by me being present, it became overwhelming to see your parent from one state to another state and going from being healthy to just starting to slowly go downhill. It's very painful and very hurtful to see that because you just never know when you have to be that caregiver or have to be that support system for your family. That's why you have to understand versus men, the same thing. You have to be a caregiver for your dad if your dad has been diagnosed with breast cancer. And most of you sit here and laugh and joke, but what I said again, I take what I say very seriously. What I share with you all is very informative. You can help somebody because somebody may be going through this right now and may not have answers and they don't know which way to go. They may have been diagnosed with breast cancer or a male has been diagnosed. Share this live with them so they can watch this video to get an insight about what they are expecting. So many people who've been diagnosed with this have so many questions, how many things they need answers, and they're just, and first and foremost, they're in a state of shock because of what they are experiencing. And that is very, very important. When you ask questions, and if you have questions, write them down and begin to just ask it because you don't know what to say or how to handle it. This is why it's good to inform people. Breast cancer is year round, domestic violence is all the time, bullying prevention, all these awarenesses are represented in October, but all these things continue to go on after the month of October. It goes on 365 days a year, and then every day is 366 leap year. But these things still going on after the awareness is being shared. That's why you have to be very proactive and bring these attention because who are in nonprofit agencies talk about breast cancer all the time. Those who are in agencies for domestic violence, that's their go-to topic. Those who deal with bullying prevention, this is what they talk about. This is their content. This is their area of expertise, and they learn so much. They go through training after training after training after training. And it's so important. Those who are in the mental health aspect, the same thing. They go after training to learn about these things to help other people. Because there's always new cases of breast cancer. There's always new cases of domestic violence. There's always new cases of bullying. There's always new cases of mental health. It's all new cases. All these things that I'm sharing with you all is going to help you. It's going to help you understand what this really means and what you can do to help somebody else in these type of situations. Lord, we thank you. Thank you, thank you, thank you for the opportunity to just allow me to speak and talk and educate and give people of One Time Ministry knowledge about things that goes on in the body. God, I just thank you for just another day, and thank you for guiding us and leading us and everywhere we're going, Father. I thank you for your love, compassion, and understanding of our lives and just being God. We just thank you and honor you and praise you and bless your holy name. As we meet, as we depart and go our separate ways, I pray a covering over every man, woman, and child that's tuning into the live and the replay, that everything work together for their good, oh God. Lord, we thank you to honor you and bless your holy name. In Jesus' name we pray. Amen. Also, too, before I end this live, there may be kids who may be experiencing in the home about, their mom or dad, or maybe both, and they're having questions and answers. What can I do as a child to get that support? It's very, very important. It's questions everywhere. And there's support. So to find the support groups, they're all over social media. They're all over in the community. 211 411, reach out and touch someone and say, hey, I need to find a support group because such and such, I'm a loved one who has somebody going through this and I don't know what to do and I don't know how to handle it. And these are very, very important topics, everybody, to embed into our children. And it kind of dropped in my spirit as I was praying, like mention that our children and our teenagers and even young adults may need that outlet to just know there is support out there. Don't be afraid to talk and speak to people. A lot of times we get shied away because we've been rejected so many times. But I'm telling you, when you get connected with the right people, you'll be able to understand what these nuggets and jewels that you are learning, that it'll help you have a better navigation of what those things really are. All right, I love each and every last one of you all. Don't forget we have services this upcoming Sunday at 8 a.m. We have Bible study this upcoming Monday at 7:30 p.m. The replay of the revival will be on Instagram. You can watch the replay on social media outlets. Looks like Instagram had blocked my lives in terms of people watching it, so you can't watch it on Instagram because they didn't block this, so nobody can watch it on YouTube, unfortunately. Sad to say, they got me a couple of times for copyright content. I do not own copyrights. They still do what they do. But I'm going to probably revise it and post it up again for you all to see it. So I got a lot of work to do this weekend. Editing, copying, you can name it, all this good stuff. And again, I love each and every last one of you. I'm going to put the remaining content of the breast cancer awareness on Instagram so everybody can see it. Like I said, if you have any questions and concerns, you can reach me office hours Monday a.m. to 8 p.m. Saturdays and Sundays it's 7 a.m. to 6 p.m. You all have a blessed and a fantastic weekend. Don't forget we have Halloween festivities. Just be safe out there. Be careful out there. Have a lot of false festivals that are going on this weekend. Make sure your kids are safe. Make sure they are prepared, and just be mindful of the places and things that you're going and stay prayed up out here this weekend. We'll all be